Okay.
I'll start with the obvious. So your dad had a heart attack. He was put on anticoagulation therapy as part of his treatment. Because of the anticoagulation therapy, he developed a bleed in the right frontal lobe. So if you separate the brain midline from left to right, straight up the nose, all the way down the back through to the crown, his bleed's here in the right frontal lobe. And it's shifting the center of his brain to the left, approximately 7 millimeters as of 2 days ago when the MRI was done. Because of the stroke, he's really high risk for aspiration. He's not able to feed himself, so we have to keep the head of the bed at least 30 degrees at all times. We're also feeding him by a feeding tube that's inserted through his nose down into the stomach, and he's continuously getting tube feeding for nutrition. Intravenously, we have a central PICC line here. This is where we're giving him IV fluids as needed. Yesterday he got a unit of blood all through this. So as you can see, his arms are kind of bruised.
Right.
Really edematous. Some of that is due to probably heart failure related to the heart attack, the swelling. And you know, kidneys not working necessarily properly. He does have that issue also, and when you don't move enough fluid across the membrane in the kidneys, fluid's got to go somewhere. If you're not making urine, it's got to go other places. So in your father's case, in his arms, there's some swelling in his hips, also in his genitalia. Obviously, we probably don't want to take a picture of that.
No, that's fine.
He has some skin issues. I'm assuming he may have probably fallen down, or so we have some. We're doing wound care. He has a small skin tear here, which we're keeping clean and obviously treating it. Also has one on his upper back on the left side. He has these little small kind of skin tags. You know, as you get older, you develop skin tags. And one of them looks like it had a small abrasion, so we're treating that. He also has a wound on his bottom. You know, as his protein intake's kind of poor, he's not able to take in a lot of food. Obviously, based on his condition, he's not mobile. So we're having to turn him. We have him on a special bed, which is a pressure relieving mattress. It's basically like floating on a pillow of air. So those pressure points, you know, any bony prominence, you put pressure on it, any pressure can cause an open break in the skin. He has one right on his bottom. Then to keep his heels nice and treated, we obviously have these particular boots. And then, of course, we're squeezing his legs to prevent blood clots in his legs. These are called sequential compression devices.
Right, I've seen those.
And that, you know, if you have like any kind of large bone surgery, like knee replacement, hip replacement, we're going to be squeezing your legs to keep you from forming clots, because those natural muscle pumps in the legs aren't working properly or normally.
Right, right.
What else would you like me to talk about?
I think that's good. I don't want to run this out completely, so I'll